Hello. I'd like to begin by acknowledging the traditional owners of the lands on which we meet, the Wurundjeri people of the Kulin Nations, and pay my respects to elders past and present. Welcome to week 5 of HEA 10002. In this subject, we first spoke about biological determinants of health, those factors that predispose certain people to certain types of diseases. These included genetics, age, sex, and ancestry. We then turned our focus to culture, and we did that as we know that experiences of health, well-being, and of disease are culturally dependent. We now turn our focus to the social determinants of health. To begin, a definition. A definition provided by the World Health Organization appears on screen. The social determinants of health are the conditions in which people are born, grow, live, work, and age. These circumstances are shaped by the distribution of money, power, and resources at global, national, and local levels. The social determinants of health are most likely responsible for health inequities, the unfair and avoidable differences in health status seen within and between countries. I will now show a small part of a video intended to bring this definition to life. Animation, alas, is not my strong suit.
Hi, and welcome to this video on the social determinants of health. This is a very important concept to understand because its impact on the health of individuals and of populations. We'll be taking a look at what it is, how it impacts health, and a useful framework to understand it. Take a look around you, your family, friends, and other people around you. What's clear is that health is quite variable, not just between individuals, but also across different population groups. Let's take an example. In 2015, the life expectancy of a child born in Sierra Leone was 50 years, whereas in Australia it was 83 years, a difference of 33 years. But there are differences even within countries. For example, in Australia, the life expectancy of Indigenous people is about 10 years lower than that of non-Indigenous people. Within a population, health is also influenced by social status. People with higher income, a higher level of education, and a better occupation have better health and a greater life expectancy. Health status can change as well. For example, studies of migrants have shown that the type of diseases, health behaviors, and risk factors are different in migrants compared to those in their country of origin. So why is there so much variability? To answer that question, we must understand the factors that can influence health. Let's have a look. A person's health is influenced by a range of factors called determinants of health. These include who they are, individual factors such as age, sex, and genetic makeup, and also what they do. This includes their health behaviors such as smoking, physical activity, alcohol use, and diet. Health is also largely influenced by the conditions in which people are born, grow, live, work, and age. These include their social and community networks, the socioeconomic, cultural, and environmental conditions that people live in, and also health systems. These are collectively called the social determinants of health. The social determinants of health are ultimately shaped by the distribution of money, power, and resources at an international, national, and local level. They have a marked influence on health inequities, which is the unfair and avoidable health differences between different groups of people within countries or between countries.
Welcome back. So, what do we mean when we say social determinants? The World Health Organization has identified 10 of these, which appear on screen. The single strongest predictor of health and well-being, however, is the social gradient, this first one. So let's look at this in more detail. What do we mean by the social gradient? Well, effectively, it's a measure of your socioeconomic status, and it's determined by 4 factors: your income, your education, your place of residence, for instance, whether you live in the north of Albania or North Melbourne, and your occupation. So people at the top of this gradient have a high socioeconomic status. They have a secure income. They most likely have a university degree. They live in a country where there are policies and practices for the safe disposal of human waste, and they have a job that does not expose them to hazards or risks. People at the other end of this scale are likely to have no formal education, low or no income, and are perhaps involved in dangerous work necessary for survival. Where you are on this gradient, and this is important to know for your quiz, is the single strongest predictor of your health and well-being. Let's look at the social gradient in practice. On screen are a series of charts that map out the effects of the social gradient on mortality, specifically death rates of children under the age of 5. What do you see? Okay, firstly, if your bar is green, you're at the higher, more affluent end of the social gradient. If your bar is blue, you're at the poorer end. What can we say about this data? Well, as you might have observed, child mortality rates vary between countries. They're highest in India and lowest in Brazil. Secondly, child mortality is highest among the poorest households, invariant of what country you're in. But thirdly, and here we really see what is meant by gradient, the higher the socioeconomic level of the household, the lower the mortality rate. So we get a kind of inverse scale here across all countries. The higher you are in terms of your SES status, the lower the mortality rate. What is the take-home message here? Well, people at the bottom end of the social gradient, those with the least power and resources, are more likely to experience premature death than those at the top. Why should we consider the social determinants of health? Because these are the fundamental causes of a wide range of health outcomes and health inequities. By focusing on these and how they impact health, we're able to discuss genuine solutions and avoid misdirection of efforts. One way to get to the root cause of the social determinants of health and health inequity is to use the but why technique. This technique is essentially a process of continual inquiry, but it's best seen in action, so let's get started. Consider this. A young trans person presents to emergency following a suicide attempt. You could ask yourself, but why? Well, we know that 48% of trans youth in Australia have attempted suicide, so this behaviour is convergent with the national trend. And again we ask, but why? We also know that trans youth are 10 times more likely to experience depression, which is a risk factor for suicide. Yeah, but why are they more likely to experience depression? Well, trans youth experience ruptures in traditional networks of care, so they're more likely to experience peer rejection, family rejection. They're more likely to experience homelessness or housing insecurity and experience violence. But why? Well, we can then look at a cultural norm. So in Australia, there is a culture of what we term cisnormativity. Your gender is presumed to be fixed at birth and based on very binary categories of male and female. Yeah, but why? So here we see that this process is continuous. Okay, I see a quiz question here. What is the purpose of the but why technique? Hopefully, evident from the example we just worked through, it's to help us identify the root cause of a problem. As we saw, we went from a single behaviour, the presentation of a trans person in the ED, the emergency department, to identifying a systemic cultural norm that sees trans people as the other. Something that is manifest in, for example, the binary design of bathrooms, sporting team allocations, and administrative and legal processes. What this but why process does is it identifies multiple root causes. It also enables us to see several pathways to address health inequity. For instance, in the example of trans youth, we could increase the number of free counselling and peer support services to trans youth to help address the issues associated with family rejection, peer rejection, harassment and violence. Or we could look upstream, a term that will be introduced in the next video, to consider some of the cultural norms that enable violence against trans people. This concludes the first video for week 5. Next we consider pathways to action and the specific ways in which social determinants affect populations differently.